The vaccination drive, the government has now cleared the second phase with COVID shots which will be given to all citizens above the age of 60 from the 1st of March. There will be jabs for 45-year-plus citizens with co-morbidities from the 1st of March. The government says the vaccine will be free at government centres and there will be paid injections at private centres in phase 2. So this is something which will directly impact millions and will accelerate the pace of vaccination in the country. The government says a decision on the cost of the vaccine will come in a few days. The shots will be given at 10,000 government-run centres. Around 27 crore are expected to be covered in the second phase.
Now, this vaccination second phase will start from Monday the next, 1st March 2021. So 60 plus anybody and 45 plus with comorbidities will be given vaccines in 10,000 government medical facilities. Whoever goes to the government clinic, government center, will be administered vaccine free of cost. Who want to get vaccination from private hospitals will have to pay. What amount will be paid will be decided and declared by Health Ministry within next 3-4 days.
My colleague Sukirti Dwivedi joins us now. Sukirti, we've been talking about this for how long now? Several weeks at the very least. But it's happening now. It brings hope to millions across the country. So many senior citizens worried that there was a delay in them getting vaccinated. And those who are younger as well with comorbidities will get the injection sooner than later. So that's great news. But how is it all going to work? How do people register? Where do they have to go? Are there any details at this stage?
Well, Vishnu, the exact modalities have not been announced by the Health Ministry yet, but what is expected to happen is that at least in a day or two, COVID will be launched for the public and they will be able to check whether their names are already into the system or not, because the government has already been bulk uploading data based on all the details given out in the electoral roll. So most of the data is already in there. But in case anybody finds that their name is not there in the system, then there will be several options that will be available to them. Either they can self-register through the mobile application or the website, or they can go to the nearest district level official or a block level official and they will assist them in getting themselves registered. But this is going to be a process whose modalities have not been announced yet, but whatever we've been hearing from government officials so far is that they will try to create a system in a manner that somebody who's not tech savvy is also able to register themselves, and officials present on ground should be able to help them with that. So that's as far as COVID is concerned. And then of course the issue of comorbidities also is there, which Mr. Javadekar today said that the Health Ministry will explain further on that certain diseases like disease, hypertension, cancers, chronic respiratory disorders, those are among the main criteria on which comorbidities will be decided, and people will be required to get a sort of medical certificate from their physician saying that so-and-so person is a patient of hypertension and whether they're a chronic patient of hypertension or not. So those things will also be looked at. So those are some of the options that have been that we've been reporting so far are likely to be available for the general public, so that people, especially senior citizens who are not very used to operating computer systems or mobile applications, they should also be able to ensure that they also get vaccinated. So all of those details still awaited, but we are expecting that the public launch of COVID should happen in a day or two, considering 4 days from now the vaccinations are set to begin.
All right. And of course, Sukirti, this comes at a time when there's been a huge upsurge in the number of COVID cases, primarily out of a couple of states, but the overall India numbers are now worrying. So the more people who get vaccinated, the better. Thanks so much for being with us and sharing those details.